ways. But the core part of all of this is that for a variety of reasons, the hormone system is dysregulated. But what regulates the hormone system? So this is where if you want to drive a herbalist crackers, you'll say, what herb can I use for? Whether it's eczema, allergies, what's the one herb? What's the cure? And it's not like that in the world of herbal medicine. In the world of herbal medicine, we use herbs as like a soup. You wouldn't make a nutritious soup out of just onions or just carrots. So everything that I talk about in the beginning of this talk will be leading up to what are the herbs that directly influence hormone levels. But that needs to cover a whole variety of things in the meantime. So the first thing I'll talk about is connection. Women are amazing. Women are absolutely amazing. Women have the capacity to create. And to do that, there is a cycle that is either fulfilled or not fulfilled with the pregnancy. But the potential is always there. That's extraordinary. The complexity of women's immune system and hormone system in order to be conception ready. It's like really fine lace. It's like embroidery. It's like a fantastic picture with lots of layers. It's like a massive fun fair where some of the influences are like massive roller coasters and others are like the little teacups that go around for the toddlers. And some of them are the canoes that go down through the waterfall-y kind of things. So that's just to give you an idea of how to look at it, that there's no one hormone, there's no even 2 or 3 hormones, because they're all connected. There's lots of circles in medicine, and the thyroid, adrenals, thyroid, adrenals, and the liver function would be one of those. The gut, the microbiome, and the liver is another. So connection is very important. Connection within each woman, all the things connecting to themselves and connecting to the outside. I'm sure you have experienced somewhere in your life where you're living with other women, and eventually after a few months, all the periods, come within the same week or 10 days. So none of us are alone. If you have PMS or PMDD, the depression element of it, it feels like you are, but you're not. You're connected to every woman in the universe. You're connected to the moon. And one of the things I suggest to people is to walk in with their bare feet on the ground, and to lie on the floor of a woods, and look at the sky through the trees, especially coming into spring and summer, and to look at the horizon. So, and that is to emphasize all the connectivity. And the other thing that makes a big difference to mood, if you, throughout the cycle, if you expose yourself to sunlight, especially around sunrise in the morning and sunset in the evening, but any time of the day, and without sunglasses, right? When I grew up, nobody wore sunglasses. They were, Hollywood cool. But sunglasses means that your eyes don't get the effect of the sun rays at the back of the head, back of the eye. Now, that doesn't mean that you spend hours in glaring sunlight, everything in small amounts and moderation, but not to ever experience the sunlight is also a deficit. The thing that people find most surprising about a holistic way of dealing with hormone balance, is emphasis on fiber in the diet. Okay. What escorts all of the breakdown products of the hormone balance and cholesterol, which is closely related to the hormone, to the reproductive hormones, is fiber. Most of us have about 7 or 8 grams of fiber, and the advised amount is 15 grams. And the answer to this is to take more fiber in all of the foods, especially the skins of fruit and vegetables, and whole grains and things like porridge. But in addition to porridge, also the oat bran. These are soluble fibers that are very good for hormone and drug and toxins of all kinds excretion. If you need more, then I advise psyllium husks, Psyllium, psyllium husks. And you would use about 2 to 3 teaspoons a day. You can mix it in with porridge or banana, or mash it into yogurt, whatever. But I highly recommend, if you're having serious problems with your hormone cycle, then please add in the psyllium husks and as much fiber in the diet as you can, and just look up all the sources of fiber. In fact, it's a lot of these foods are listed in our hormone balancing leaflet, which will be on the website, accessible for you, so you can help yourselves to that. After fiber, the important thing in the diet is the essential fatty acids. Without essential fatty acids, the nervous system struggles, the immune system struggles, the gut flora struggles, everything struggles. So these are, again, a handout that we have on the essential fatty acids: nuts, seeds, avocado, oily fish. But there are very specific amounts, the minimum of which, or the kind of the amount that's good for keeping everything functioning optimally. I always go for foods first, because that's the year to come. Okay, so even after the menopause, these are different for other reasons. So as I said, the sex hormones, the adrenal and the thyroid, are intimately connected, and I'll show you a diagram in a minute. After that, the important thing is the liver, because the liver is what breaks down the hormone products that we no longer need, and escorts them out, alongside the fiber. That's why the fiber is so useful. So we need the liver enzymes to be functioning well, and we need the bile to be produced, and we need the outcome of using herbal medicine for period problems. If you have mild period problems, there's every likelihood that the herbal medicines, herbal teas and foods, and all of this holistic way of looking after it will knock them out of the park. If you have moderate to severe problems, then they're likely to take several months to bring them into the mild range. So it's not an instant cure. If they're very severe, I would probably recommend that you see a medical herbalist. But you can still do your own path. It'll just take a little bit longer, just based on my experience. But no reason not to take all of this advice and do your own thing. So when I said I had a diagram for the I call this the hormone Olympics. So if you look at this one here, this is the pineal gland, which is our third eye at the base of the deeply embedded in the brain. Then we have the pituitary and hypothalamus, which are between the eyebrows and just behind. Then we have the adrenal gland, the thyroid gland, the pancreas. So sugar metabolism, vitally important to this. Here we have sex hormones and fat. And over here we have the gut and the microbiome. The microbiome, which is all of the bugs in the gut, they also produce small peptide hormones, which are very influential. So these are all floating around in your bloodstream, because that's the definition of a hormone. It's a chemical that's distributed to every cell in the body via the bloodstream, right? So it's a messenger. It's a messenger for your body to do stuff. That's what a hormone is. So if you've got any of these problems, then your hormones are doing stuff that you don't want them to do. And it's generally based on inflammation. Nearly all of the chronic conditions that we're coping with in pandemic amounts in all of the industrialized societies come down to meta-inflammation, which is where everything is just slightly running a little bit on speed, okay, and creating too much heat and work. That's, I forgot to mention, the black area in the middle is vitamin D. All right. So this gives you a good clue as to why vitamin D influences the effects of all of these hormones on every cell in your body. So I recommend, if you're having difficulty with hormone balance, that you take a vitamin D supplement. So that's you. You're out walking in the woods, you're connecting with the earth, you're getting the sunshine, you're eating the fiber. You understand about the essential fatty acids, which are the oily fish, nuts and seeds, and avocados. And we're going on now to talk about what herbs might be good for the symptoms of all of the conditions that I've described that you're living with have all of those issues in common. So that's what you address first. If you have a lot of digestive problems, and especially if you have severe PMS or PCOS or endometriosis, that's an additional reason for seeing a medical herbalist. Geography is no longer an issue because we can do online appointments. But if you have a well-qualified medical herbalist near you, I recommend that that's who you see. Okay, because it's a much more present and real experience of seeing a herbalist in person. Okay. So if we think of what's common to all of those dysregulations, well, then we're talking about inflammation. For that, we want to cool down, and the hottest organ in the body is the liver. So before we touch a liver herb, I would always suggest that you use dandelion root. You can add in milk thistle as well, now called silymarin. You can add in milk thistle as well. But I never use milk thistle without dandelion root, because dandelion root supports the production of bile and the flow of the bile. If you use the milk thistle to only support the enzyme function, then you can have more products produced, but they're not being eliminated. So it's good to use the two together, and even simply to use the dandelion root, because the dandelion root does everything. It does the enzymes, bile production and bile flow, and it has a bitter taste. Anything that tastes bitter balances the autonomic nervous system. So there's inflammation, and there's also problems with the autonomic nervous system. I mean, I would go so far as to say that there's very, very commonly problems with the lymph, which has got to do with elimination. So we use a lot of herbs that have an action called alteratives. You won't find it in a dictionary, but herbalists have been using this term for hundreds of years, and it's about depurification or elimination. And that sounds very wishy-washy, but it's actually about promoting lymph flow, kidney function, and liver function in a coordinated way, so that they have a cleansing effect in total. Okay, that makes more sense. Let's do a few little practical things, because this is all a bit heady, isn't it? If you get pain, then one of the things that you can do is use castor oil pack. So you can get a bottle of castor oil anywhere, and put a little bit on your hand, rub it all across your lower belly, and then put cling film over it, and then put a hot water bottle, or the beads, the bag of beads that you put in the microwave. That and warming plates are the only useful things to do with the microwave. So that is just so nice. In the castor oil, you can put in lavender oil, mandarin orange. They're both very inexpensive, and get them from a good supplier. It doesn't have to be us, but there's ones that are used in candles, and they're if they're too inexpensive, I can guarantee you that they're synthetic additives. So get them in. There's a nice Irish producer called Atlantic Aromatics that you can get in a lot of health food stores, and I'm very happy to promote them. They've been around a long time, and they know their suppliers, and they know their business inside out. Okay, so that's a little practical thing. Now, I've actually been doing this kind of women's medicine long before I ever heard of a herb, because I used to do a PMS clinic in Mary Stopes clinic in London, about 45 years ago. And what I learned from listening to people then was that women were using the calendar month as though they didn't have menstruation, right? Women don't live according to calendar months. Calendar months came in with the Roman Catholic Church in the Gregorian era, or Pope Gregory, I think, hundreds of years ago. He didn't consult women. He was too busy doing witch hunts. I think it was around the same time. So what you want to do is ignore of course, you use it for your holidays and booking your flights and everything, but your life goes according to your menstrual cycle. So if there's something that's very strenuous or difficult or mentally challenging, you don't leave it to the week before your period. If you have PMS or PMDD, that's your coast. That's your nice slide with a gentle roll. So everything else, your tax returns, your parent-teacher association, your presentation at work, if you can organize your driving test, you do that in the first part of your cycle. So that's your highly functioning, zoned in. And what women do, they think that's what's normal, but it's not. That's what's normal for the first half of the cycle. For the second half of the cycle, you're just rolling home. Okay. That makes a huge, huge, huge difference, particularly for the psychological aspects. Oh, do you know, I forgot to cover a very important one, which is if you're not getting enough sleep, it's going to aggravate everything. It's nearly so obvious I forgot to say it. So sleep hygiene is important. And if you look up just sleep hygiene, I don't know why they call it sleep hygiene. I don't know anybody who has dirty sleep. So, but there you go. If you just look it up, it'll tell you all the things to do. You know, make sure it's dark. Don't have stimulating things around your bedroom. No screens. No screens is very important. Okay. So we have the other little practical thing, which I do all the time, is the dandelion coffee. And this is dandelions. And sorry, I'm in your way. Did I turn this off? Oh, okay. No, I know. Oh, he's so clever. Thank you. So we have the dandelion coffee. And I use this. I tried putting it in the coffee bean grinder, but coffee is actually quite oily. You'll know that if you look, there's oil glistening in your coffee. So, and the same with the dandelion root. That's how you know there's oils in it. So I just use this. I mix it in with my coffee or my decaf coffee before 12 or 2 o'clock, and then after that I just use the dandelion coffee. Very nice. Okay, it's I mean, I'm not a coffee aficionado, but it suits me fine, and it's therapeutic. It's got bitters effect, promotes the bile, all the things that I was saying. So where are we now? Hormone balancing foods. Okay, so should we go on to the herbs that are useful? There's hormone balancing spices one is called fenugreek, and we have those. You can get those in tincture or they're here, in tincture or in capsules, and these contain plant estrogens. Although I was reading an article today, which is actually there's a change of name going on, because plant estrogens, phytoestrogens, is actually very confusing. It makes it sound like there's this direct estrogens, unspecified, and they're now actually calling them phytoserms, which is plant selective estrogen receptor module agents, and that's a much more balanced action. That leads down the road towards an effect that discourages cancer cells. This isn't a treatment for cancer, don't get me wrong, but it discourages. It's the opposite of the estrogen receptors that are implicated with the BRCA gene. Let's put it like that. So there's no concerns about that. And what the plant estrogens, or phytoserms, as I'm now going to call them, what they do is they fill the estrogen receptors with a much milder estrogen effect. So it modulates the estrogen. And most people, they have, during the menstrual years, they might have too much of an estrogen drive. So that's very, very balancing. And the other direct herb, so we have that's available in tincture or capsules. And the other herb that directly affects the cycle is the chaste tree, which is this one. Chaste tree is also called Agnus castus, or chaste tree, or Vitex agnus castus. And this has an effect of balancing the progesterone. Again, it's not progestogenic. And this is a very important effect or kind of description for herbs. The vast majority of herbs have a modulating effect. If the body needs an estrogen effect, it'll have a very gentle estrogen effect. If the body needs an estrogen effect even more, you take the Vitex because it balances the progesterone, which then balances the estrogen progesterone balance. So the chaste tree is particularly good for irregular cycles. It can be used with all of the other women's herbs. It can also be used by teenage boys along with our skin blend herbs for acne. Because it balances the hormones rather than overwhelms them or pushes them too hard. So they're particular, and the other particular capsules we have are the feverfew, and the feverfew is particularly good for pain. It works in a way similar to, it's not a non-steroidal anti-inflammatory, but it does have an influence on some of the same enzyme cascades. But as a whole herb, it can be useful for migraine, and particularly for people who have headaches. I didn't go through all of the usual symptoms in that categorical way, because you're all only interested in the ones that affect you personally, and you're all, I'm sure, very familiar of the description of them. So for women who tend to get the headachy effect of PMS or other hormone issues, the feverfew is particularly useful. And you can actually use the feverfew, if that's a main problem, you can actually use the feverfew regularly for the second half of the cycle. Now, there is a little addendum to the chaste tree, is that it does promote fertility. So if you need to use the usual precautions if you want to avoid a pregnancy, but just be particularly diligent about them. Okay. So I think that's some of the, I kind of did these a bit back to front, didn't I? So I'm going to talk now about the herbs that we have in our general mix, which is the women's blend. So this is the one which has a balancing effect on all of those conditions that are common to all of the problems that women present with their menstruation. And don't forget, going back to this, the vast majority of women have no problems with their menstruation. A small percentage do. And it's a reflection of how amazing women are, because sometimes in medical things, you end up that being a woman is a problem. Being a woman isn't a problem, but managing this very complex physiology in a very complex world can be challenging. I think that's a good way of saying it. What do you think, guys? Okay. So the herbs we have in the women's blend are sage. There's a lot of sage, and red clover is in the tincture blend. And these have a reasonable amount of research. There's also dandelion root. Now, a century ago, I wouldn't have used dandelion root in a hormone balancing, but because of sugar, processed food, both of which will send all of your women's hormone problems crazy, all right? But they're also part of a physiological condition where you crave them. Nobody is going to tell me that chocolate does not have an effect on hormone balance. I don't think we need to do an evidence-based randomized controlled clinical trial to know that chocolate is very attractive on the days before your period, especially when you're miserable. And there's reasons for it. There's the anandamine, and not theophylline, but xanthine. Can't remember the name of it, but anyway, there's good reason to believe that this is the effect that it has. But the dark chocolate is way better, okay? And the darker the better, the better, the better. All right. So dandelion root. So these problems were not nearly as, and we didn't have all of the endocrine disrupting hormones and plastics around all of our foods, including fatty foods like cheese. All of these things have an influence on our environmental load of these things. Weed killers, please, people, don't use weed killers in your gardens. They're not good for anybody. Okay, so dandelion root, Chinese angelica, which is dong quai. Not much research on it. That's very positive. But remember, when they do the research, they're really doing research to see if they can steal one of the constituents in order to make medicines out of them. Um, they're not doing it to promote the benefits of herbal medicine. So they're all researched one by one rather than in blends. And even with that, they're often researched using an enhanced extract, which confuses the situation even more. So it can be quite confusing to read the research. But it's a traditional use, and I find it wouldn't be without it. Peony is a particular ovarian nutritive herb, and I wouldn't use that for, I would particularly use it for PMS, but when I'm making a general blend based on the tradition and the science, I want to include also people who have PCOS and endometriosis. So that's why that's in there. Lavender, does anybody have a hormone problem that isn't associated with anxiety? But does anybody have any medical problem that isn't associated with or made worse by anxiety and stress? So that's not very specific. Bacopa is a herb which is anti-inflammatory, immune balancing, cognitive balancing. That's why I put that in, because sometimes before your period or when you have any of these hormone imbalances, it does feel you get brain fog and difficulty concentrating, difficult remembering, and coordination. So all of that neurological feature, which is related to your gut and your hormone balance and your adrenal gland, and there you go. It's the whole picture. And the last one in there is Siberian ginseng. I don't know if you're familiar with the concept of adaptogens, but Siberian ginseng is an adaptogen which helps our performance in managing stress. So it's about resilience and stress balancing. So if you think of all of the things that women with menstrual problems complain of, the bloating, gut discomfort, brain fog, anxiety, sleep problems, the lavender is very good for the sleep, pain, which would be the Angelica sinensis, the dandelion root, the lavender, they would all be good for pain. And to that, pain was a big problem. I would add in the feverfew for the days of the period. And if you get very headachy, then from the second half of the cycle. If you have slightly irregular periods, I would add in chaste tree, 2.5 mils in the morning for the second half of the cycle and throughout the menses. So that's to kind of give you an idea as to how they would overlap. And now I will throw the tea into the mix. We're working out a pattern here, aren't we? Here, let's see if we can find the image for you. This is so much more fun than doing it by myself. Okay, we're nearly there. I'll hold it up as well. Okay, so this is the women's tea. And we have red clover, wild oats. Now, you know the expression to sow your wild oats. This comes from stamina, particularly from the perspective of Don Juan, and not Don Juan, who was anyway, romantic reproductive energy to sow your wild oats. And this is where sleep comes in as well. Sleep is very important. So then we have raspberry leaves. Raspberry leaves is very good for toning and congesting, along with yarrow, which is the next one. And guess what, guys? They also tone and decongest the gut. So you have two influences. And toning and astringency is, if you drink black tea, you can get a puckering inside your cheeks. And that's astringency. It's a drying of the mucous membranes. So that seals the gut and helps tone the uterus in particular. What else do we have left? Oh, rose. Who doesn't want roses in their life and in their teapot? Rose is very soothing and gentle for the nervous system and for the gut. It's calming. It smells nice, it tastes nice, and it is nice. All right. And the last one is dandelion leaves. Many of you might get bloating, and fluid retention is part of the the period mix as part of your period problems, and the tea. Let's just go through when I would use what. Okay, so if I have background premenstrual problems, endometriosis, PCOS, mild, then the other thing about all of these herbs and the dandelion leaf and root is that they have a very good effect on sugar metabolism, which is particularly relevant to polycystic ovarian syndrome. The toning of the gut and the womb is also very good for PCOS. The astringency is perfect, and the hormone balance is particularly good for endometriosis. I am so warm here, guys. You wouldn't open that patio door there, would you, if you just slide it? It is really, really warm in the clinic tonight. Okay, and imagine it's the middle of March. Okay, so women's tea. Okay. So the women's tea is to be taken every day. We have two forms of it. One is a loose bag of tea, and the other is a 3 teaspoon sachet. That is in a very big tea. It's the equivalent. Each sachet is the equivalent of 3 tea bags, and it's just much more convenient. Some people use the tea when they're in their regular routine, and then if they're going away for the weekend, they take the tea sachets. Some people prefer the tea sachets all the time. So this is your background. If you have severe, mild to moderate, you then add in the women's blend for the second half of the cycle. If it's very severe problems to do with any of these things, you take the tea and the women's blend throughout. So people learn what's good for them, how to titrate it. The staff here will always advise you. Write down all of those herbs. We sell them all individually. We sell them all as tinctures. There are another 50 herbs that can be helpful. These are just the ones that we formulated that can be, because they can be registered as foods. So there's lots of other ones. Okay. And then you can take the feverfew, the Vitex, you take a capsule or 2.5 mils in the morning to regulate the period if they're very irregular. And if it's mainly, you can also take it for just the second half of the cycle. And there's only one way to find out what's the right one for you, which is to try it. Okay. Right, we've covered a lot, haven't we? Okay, so I'm just going to do a couple of other things that I have a passion about. One is avoiding all this plastic and gels and things that, you know, absorb blue ink, or I don't know why it's blue on all these ads. And each one has plastic packaging. I mean, really? This one at least is cardboard and paper. So you do, and then you can get ones that are organic cotton, right? But here's a way of avoiding all of this expense and plastic. It's a moon cup, also called a menstrual cup. Even more designed, I had somebody in today who had a marina coil in, and I suggested to her that she use a natural sponge. It has to be a natural sponge. Tie a firm thread around it, and put that inside, and then rinse it out with cold water. And you can also get the pads. We didn't have them. I think I was one of the first retailers to retail them in Ireland. No, that's not one. But I couldn't sell them. Nobody had heard of them. This was about 8 or 9 years ago. So we're going to see if we can get another supply. But the pads, I think you can get them in pennies, where they slip into a panties. So go to Pennies and see what they have in their range. But you can also get ones that tuck behind your panties and clip with a little fastener. So all of those things, and people go, oh no, I can't do that like all the time. This isn't all the time. It can be that you use some of these things at night, and then just rinse them in cold water and put them in your washing machine. or it could be that you use them if you're not sure when your period is coming, and you keep putting pads in because it might happen, right? But it doesn't. Right? It can be very useful. And at the end of a period, for just the spotting that tails off, you can use some of these things. So you can, and sometimes you can use a pad and a sponge or a moon cup at night. So you put the thread on the sponge and you pop it inside, and you leave the thread so that you can pull it out again. Okay. So I think, have I talked about everything? I'm surrounded by things in the beginning. Oh, yes, I know it's not a menstrual problem, but we also have wild yam cream, which is for dry vagina. Oh, here's another tip. If you need to use a lubricant, you use the aloe vera gel. It's natural, and it's soothing and healing, because a lot of people get cystitis after intimacy. And using the aloe vera gel can be very useful. And the wild yam cream can be useful as a moisturizer for down there. That's what we call it. Okay. Yeah, I think that's everything. So I think I mentioned how to regulate periods. That would be using I would say the tea and the chaste tree. The tea, the herbs that are in the tea. Remember, you can get these herbs, you can grow them, you can forage for them. I don't mind how you get them. We can send them individually, but I've blended them because most people don't know about these things. So I've just blended them for your convenience. And the chaste tree, 2.5 mils in the morning. Endometriosis is such a mysterious condition. A lot of emphasis on the dandelion root. So the women's blend, the feverfew for pain, because pain is usually a big part of it. Really, if it's needs more than that, really see a herbalist. Okay. I work with Lara, Yona's daughter, and Lara sees most of the first appointments for people, and she has done the same degree in herbal medicine as I have, and she also has a postgrad diploma from Aviva Rom, which is an American doctor and herbalist, and it's a really thorough course. So she would be in very good hands. Is it normal to have a period for 9 days and heavy bleeding? One of the things about menstruation is nobody knows what's normal, and until the last 15, 20 years, nobody ever talked about it. So nobody had any idea of what was normal. But I would say a period, based on doing a lot of family planning and being a GP for over 40 years, I would say 3 to 5 days. And heavy is if you need a night pad and you have to change it overnight. Maybe you can change it once, but certainly more than twice, and leaking by the morning. That's too heavy to be usual. I avoid the word normal. That would be unusual. So 3 to 5 days. The first 3, like people are most usually heavier to begin with, and then it's very manageable, and then it peters out. So anything more than that, you need to have it investigated. Endometriosis is in particular for heavy bleeding and very painful bleeding. Endometriosis, most women end up seeing 2 or 3 specialists, and 5 years later they eventually have a laparoscopy, which is the deciding factor to whether somebody has endometriosis. But it can be a delayed diagnosis, because a lot of women are having these kinds of very long, heavy periods and not seeking help because they don't know how usual or unusual it is. And somebody, their daughter has bad cramps, use the castor oil and hot water bottle, very sick, ginger tea, add ginger to the women's blend tea, very nice, very pale when she gets it. No, I would say she's very pale, she's got problems. She's got a dysregulation of the autonomic nervous system, which is, some people can faint, where the autonomic nervous system just lets them down and they fall to the floor. So I think in that case, it will probably need a herbal medicine consultation if you want to use alternatives. People go on the pill. The pill just stops your whole menstrual cycle. It doesn't correct the problem, it just smothers it. If you're on the pill, I suggest you take B complex, because it can make your B vitamins deplete. Now, if somebody is having very severe periods and they're coming up to big events in their life, there's no problem with taking it for a short period of time. But I don't like teenagers going on the pill for 7 years because their periods are too difficult to manage. I don't think that's the right solution for a problem. In the same way that I've been prescribing HRT right throughout the time when it was very difficult to get prescribed for women who have severe problems, but I don't expect them to be on it for 5 years. You know, it's you resolve problems so that you can then stop using the hormone suppression because you don't need it. Yeah, so this is where what I call collaborative medicine. Is there a link to castor oil? No, but you can get castor oil anywhere. You know, I mean, I talk about these things, and I've developed these blends because I believe that they should be accessible to people. But these products and blends are available in quite a number of health food stores and pharmacies up and throughout Ireland, and we're expanding into Northern Ireland. So ask your local health food store if they want to stock us and contact us. That'd be great. Your cycle is short at 23 days. Is there a way to lengthen the cycle? Yes, I would. The chase tree is modulating. That's what I love about herbal medicine. If you need an influence to lengthen your cycle or shorten your cycle, but you shouldn't, a little proviso, chase tree isn't one to use for more than 12 weeks, have a break, try another 12 weeks. But if that doesn't regulate things, then see a medical herbalist. Your daughter has been bleeding for a few years. No doctor can figure out. Hard to know. Can you tell me what age she is and what investigations she's had? But if it's beyond the doctors and it's very severe, I would say it probably needs a medical herbalist appointment. 14 years for a heavy periods. Absolutely. Yeah, no problem. And at 14, unless she's very, very slight, it will be the same doses as an adult. Yeah. Yeah, no problem. Herbs are like there's an extension from food to herbs. And because they're in blends, in a 100 ml bottle, there's 20 mils approximately of each of those, and that's spread over a week. So you're talking about a soup of active ingredients, none of which have a very high dose. So that would be fine. Oh, I think Tara is busy in there putting a link to the castor oil. Thanks, Tara. Okay. Heartburn every day before I sleep. Do you think I should need to see a doctor? Whoa, okay. I have to rearrange my brain here to think about heartburn. I don't know whether it's related to your periods or not. Yes, I don't know what age you are. So something that is affecting your life on a daily basis. I think, yes, you should get it checked out. Yeah, sorry, I can't be more helpful. Talk about underactive thyroid. Okay, huge issue. What I can say is all of the things that I have described, sign in and download the essential fatty acids and the herbs for the foods and things to do for hormone balance, include the fiber, all of those things. They are to address all of this Olympics, which includes the thyroid gland. Okay. The one thing I would say is, so you can see that this is the thyroid here, this one here. So the thyroid, I think of the thyroid and the pancreas as guarding the adrenals, because the adrenals are survival, right? That's going to be the last woman standing is going to be the adrenals. For all of these things, reducing your sugar and reducing the pressure on the pancreas, massive change. For all of these, massive positive influence. And for your thyroid, good digestion, regular bowel motion, and fiber, because fiber escorts all of the thyroid, all of the hormone breakdown products out. Okay, Paula, silent endometriosis stage 3 or 4. Isn't it fascinating? Trying to manage naturally. Do you think an excision lap is necessary? Paula, that depends on so many things. Your age, whether you want to have children, where you are in that whole cycle of, your life. And if it's silent, I would certainly spend a year doing all of this natural approach, possibly having another laparoscopy, and see where you go then. Because excision, this reminds me of when I was doing obstetrics and gynecology in hospital, and we would do a lot of sterilizations, and some women would come in with massive endometriosis, like just all over the place, and they'd still have they'd have no symptoms with it. That's a difficult one. I'd need to see you and talk through that, because you don't want masses of adhesions building up. But whether surgical excision prevents these adhesions is a whole other question. So that's worth asking the gynecologist who's proposing this, if they are proposing it, because surgical interventions aren't a treatment for adhesions. Is where, because of the endometrial tissue, you're getting inflammation locally every month with your cycle. So I wouldn't go for surgical. I would go for medical management if you need to reduce the process while you are doing a natural treatment. Okay, I think that's the most specific I can be, but a big question. Yeah. Great. Hi, Natural Perfume Academy. Go away. Okay. So now I have my end notes that the products are available in your local health store, our Galway shop, and online, which is drclaresapothecary.com. Okay, we have another silent endo, stage 3 and 4, trying to manage it naturally. Oh, okay. Have you found that dairy, yeast, and gluten affect the menstrual cycle? For some people, yes. If anybody has autoimmune problems, and that includes most thyroid problems, I don't know if they have celiac or a lot of wheat intolerance, then I do suggest the gluten-free. I'm very careful not to advise globally to not eat wheat, dairy, whatever, because socially it makes a very big difference to your life if you're eating different from other people. So I don't advise it as a global thing, but for some individual patients I may do, but it depends on individual. Okay. YouTube. Yeah. Oh, she's who's 25? Somebody's 25.
Yeah.
Oh, okay. Your daughter. Okay. Use the herbs as I've talked about for 3 months. If they're not helping, make an appointment, because I would need to know. No doctor can figure out, has she had a transvaginal pelvic ultrasound? Has she had a CAT scan or MRI? Has she had an AMU blood test? So without further information, it's very hard to give a specific answer. But using all of these things will help her health overall, resilience. So they're a good place to start. But it's the irony of the irony of herbal medicine. Herbal medicine is ideally suited to mild to moderate problems. So the mild to moderate endometriosis, PCOS, and whatever. What inevitably ends up coming to our clinics, and everybody is very welcome, is the very severe issues which defy all previous treatment or diagnosis or definition. So I'm not being cagey. I'm just being realistic. Yeah. So if somebody has a severe, undiagnosed, hard to diagnose, and really incapacitating their life, it's the least you can expect of the herbal medicine is to have a specialist opinion and an individualized um, medicine for you. But that's not to say that using these over-the-counter products for a specific, for three months might not be enough. We are extremely individual and idiosyncratic. Some people, they have severe problems and it's the gentlest herbs that work. Other people have very mild problems and I have to use some of the most sturdy. I describe the use of herbal medicines as being firm but gentle. And strong. And if anybody has ever seen dandelion growing up through tarmacadam, you'll realize how forceful they are over time, how strong they are over time, because that's a radical effect, which I love that pun because the Latin for a root is radical. The root just pushes until it can separate tarmac at its most vulnerable point, and it'll track under the ground to find the most vulnerable point of the tarmac. Plants are very clever, and women are just as complex. The reason why herbs work so well for women's issues is the herbs are complex and women are complex, and every individual woman is individually complex. Men have plumbing. Sorry. I have a lovely man beside me here. Okay, so now we'll finish. So the next live talk is on April the 15th, because I'm going away for 2 weeks, and it will be about parasites and candida. So, okay, so look forward to seeing you then. Thanks, everybody, and I hope it's been useful. And yeah, goodbye.